Good afternoon. It's a great honor for me, invited by the organizer because this is the first time I attend the Shanghai Forum, especially in the field of public health. So I would like to, on behalf of the School of Public Health and my colleagues, to present a roadmap of universal health coverage in China, and also base my personal experience. I think Shanlian have already given very broad pictures in Asia countries, and I will be present as a case study in China to illustrate the more contents in detail. Especially, I think we use the same slides. We are not communicated before. But I think it's a common sense for us to just pick up from the virtual interview with Dr. Margaret Chen. What's the definition of UHC? I would like to point out some very key points. First is access. The access to all health services, that including health promotion, preventive medicine, illness, or for treatment, even rehabilitation. So it's very broad spectrum of all the health services. So this is very important point. The second point, those services should be or must be of good quality and effective. Because nowadays we always say it's coverage about health service, not considering depth with the quality and the safety of the medical services. The third point important is people must not suffer financial hardship when paying for them. So I quite agree with Margaret Chen's, his statement. And another several important point I should like to mention is that first, it needs home growth. What does home growth? Means all the measurement or approach to the university coverage, health coverage, should be based adaptation in those countries, their situation, their policy, their political leader, and their citizen of the country. So to design how to establish, start, and progress of the universal health coverage. So there's no one-size-fits-all model, fit all countries. So I think we should bear in mind of what the definition of the UHT. Then we can examine what's the progress in China now, and what's the gap we still existed. The background I should mention is that China have made great achievement on the last 3 years. That was the first initiative health system reform start from 2009 through 2011. So this is the first stage of the national initiative health system reform. So there's 5 reform pillars we call. I think all the Chinese participants have already very familiar with that, so I will be very quickly to just move it. First is speed up the medical security system. Maybe today I will mention more on that point. The second is establish the essential medicine system and the medicine supply security system. Cope with zero marks. What is zero marks? That means when you sell the price of the drug is the same price of hotel price. So in all the primary health care facility, and nowadays we are going to promote in the secondary and tertiary hospital this year. The third one is improving medical service system. That means should be established a very solid background of the grassroots facility, upgrade the community health services. So government put lots of the money on the infrastructure rebuilding. The fourth one is the strengthening public health system and promoting the provision of the basic public health service equality. So emphasize on the equality about 42 kind of services of the public health, and also more than 10 special programs of the public health services. The last one, not the least, and more important and very difficult is public hospital reform. Nowadays, in China, 17 national designated pilot cities are going conduct the public hospital reform. So this is just a very broad pictures to give you some sense of the Chinese recent 3 years health system reform. I should mention is that most important is China established a social insurance law since January of the 2011 year. So in China at this moment, still there are 3 basic medical insurance schemes in China. First is formal sectors, urban employee basic medical insurance. In the urban employee, usually in the formal sector. The second is urban residents basic medical insurance. That means dependents of some employee in the city level. The third one is related to the rural population, that new type rural cooperative medical system, or we can give an abbreviation, is the RCMS. So the coverage rate of the 3 basic medical insurance scheme has already reached to 95%. As you mentioned, you can see the line show the different countries in Asia and also in China. So in urban or rural population in China now, it's almost the coverage rate, if you mention about that, is 95. And the next 5 years will be still increase about 3 percent point. Maybe at that time to 2015 will be reached to 98% of the coverage. So the coverage of the beneficiary, if you consider the last, as for the December 2011, the first urban residents, including the urban employee, almost 473.4 million. And for the rural residents, almost, I think it's 835 million. And also, we should consider there's still a small portion of the private medical insurance. According to the latest data in 2010, it's covered about 7% of the population. So not only the social insurance, also including some private commercial insurance. The total coverage insured has reached 1.31 billion. So the coverage I just mentioned about 95. Just give you some figure. And what's the multiple layer of the medical security system in China? First, we should consider in the middle is the basic medical insurance scheme. I just mentioned about urban employee formal sector. And the second is urban residents medical insurance scheme. The third one is the rural new type RCMS. So this is the basic medical insurance scheme. If you consider what is the supplement insurance, first is the civil servant subsidy, still have get some good benefits for them. And the second is enterprise. They organize their supplementary insurance, like union peoples work in that period, and also special target for the population insurance, especially diseases. And the last one is the commercial medical insurance. Nevertheless, also have the safety net. That means urban poor or the rural poor, they can have some social medical assistance program to support as a safety net. So this is just give you ideas about what is the multiple layer of the medical security system in China. But still lots of the issues exist in the present medical insurance system. I should mention some point. First, about 150 million peasant workers migrate to the urban area, so their medical insurance cannot be transferred. So that's the big issue. It's related to the migrant people. The second is because the contribution is collected based on the jurisdiction. So every county or every prefecture or even the province, they have their own, the design how to run in the health insurance. So the beneficiary cannot get reimbursement if they search medical service outside their area. They should pay the money first, or they get the reimbursement when they back to the residence area. The third one is still have a very high out-of-pocket payment. I will show you the concrete data. And the last one is related to how to sustainable development of medical insurance, because now we're facing the issue of aging population. So those four maybe important issues we should bear in mind. But fortunately, you can see the composition of the national health accounts in China. I quite agree with Shanlian say that if you consider the out-of-pocket proportion is declining, that means maybe they still have some trouble and hardship for their financial. You can see this picture. Where is the yeah. So you can see the yellow bar, the highest out-of-payment is during the 2002 or 2000. That means before the SARS outbreak. Then later on, since the government payment is increased, so at this moment, the latest the data show the government almost 30% of the national health accounts, including. But the social expenditure, that means social insurance scheme and other supplementary insurance scheme, and also the individual out-of-payment, almost the same. That means 35. So if you consider during the first second half of the 1990 and up to the beginning of this century, you can see there's a significant reduce of out-of-payment, at least the proportion of the national health accounts. So nowadays, I think China, the GDP, the share of medical expenditure in GDP is about 4.2, mentioned before, and also the absolutely the health expenditure about 1,800 Chinese yuan, equal to 280 US dollars, but still very low, I mean, compared with other developing countries. Now, just give you our center study some about out-of-payment. It's what is the reality? Even highest to the 95 coverage of the peoples or patients, then you can see the out-of-patient still very high. The first is about urban employee medical insurance. This is the best scheme. In the secondary hospital and tertiary hospital, you can see still around, can be covered about 70 to 75 medical bill. But if you consider another two scheme is related to the urban and rural residents, you can see almost in the tertiary hospital, the patient per visit, half of medical bill inpatient will be still paid out of pocket. So this is strongly give you some evidence for that. And also you can see the government, welfare medical insurance, civil servant, and also community, commercial medical insurance and others. So that will give you idea is the out-of-pocket payment, the hardship for the financial issue still exists. And another data is also give you the catastrophic health expenditure in urban households. This is especially we survey in the Shanghai area. So this is before the health system reform. We used the 25 total non-food expenditure as a standard of catastrophic health expenditure. Also, the WHO, another indicator is 40. If you consider 40 total non-food expenditure as a standard of the catastrophic health expenditure, there will be, I think, it's a very visual cycle of the getting to the poor. So this is, if you divide the quintile of the five groups in the household, you can see even the rich group, still 11.4, is higher than 25 their income, and also 6.6 is higher than 40. So no matter, you can see the middle level even higher than the high income in groups. So that means catastrophic health expenditure is really existed, and also not only for the rural area, for the urban household is still the problem. Of course, we didn't do the repeated study. I mean, after 3 years reform, we need, during this year, we are going to household study again, so we perhaps next year, if you come to our forum, I will show you the data to you. So we consider it's important. First, it's expenditure, expanding the benefit package. Because you see the benefit package is still very low. So that is why high pay out of pocket and cannot enough to prevent ill health physical cycle. And also last year during the August, the government issued guidelines on developing additional catastrophic illness insurance scheme for the urban and the rural residents. In the rural area, Minister of Health, the previous Minister of Health, given the priority for 20 major diseases, that including some tumor diseases or end-stage renal syndrome and so on. So that will be first, the 70% cost of the medical bill will be compensated by the rural health insurance scheme. Then the remaining cost will get half reimbursement from catastrophic illness. So finally, you can think about maybe the patient catastrophic illness patients can only cover there about 15 or at most 20 for the medical bill. So which will use a part of and also the government encourage use the part of the premium to buy the commercial insurance to cover their, after the ceiling payment. This is also show you the bottom, we say the medical saving, net. This is medical assistance program in China. Just show you the latest data about 2011. So you can see the government have financial expenditure support the urban and the rural poor, and also medical aids fund also help the poor pay the premium for get insurance scheme. So finally, the last line you can see the average medical aids per capita is about 800 Chinese yuan in urban area and about 600 Chinese yuan in the rural area. So what path, China takes to reach the university targets? As I say before, Margaret Chan say is that home growth. So it is actually a successful implement of the principle of the health reform. First, point out is to ensure the basic primary health services. The second point important is strengthening the grassroots health institutions. The third one is the strengthening the mechanism to improve the capacity of healthcare based on the separation of the economic linkage between the prescribing and the dispensing. I think Chinese people have already know what is mean the three line. That means in Chinese words we call it the 保基本 强基层 建机制 I use 这个基本的 the three principle. So that will be mobilized the health resources through the public, also private partnership. And nowadays, government are going to issue lots of the documents are going to further expand the public partnership mix or partnership and so on. What is the unfinished agenda of the universal health coverage? I think at least maybe 2 or 3 points. First, the hospital payment system reform. Important, will ensure the out-of-pocket less than 30% in the beneficiary. We should further emphasize on that payment system reform. The second one is improvement of the quality and safety of the medical service. I mentioned before we not pay attention on that. So now doctor, even the internship doctor or even the GP doctor are going to emphasize on training program to to upgrade their capacity. And the second is hospital accreditation. Now is at the moment going to improve the quality. The last one, integration of hospital and health information system. Government put lots of the money and are going to establish EHR and also EHMR. Finally, I would like to give some conclusion. That will be give some message you can take homes. The first is China has made a remarkable progress in health system reform, but still have a big gap towards achievement UHC. If according to the WHO's definition, we have still a long way to go. The second is to advance the transition to the universal health coverage, the access of quality and affordable health services, including improving health insurance benefit package and the financial risk protection, needed to be revisited. The last point is that we now, during the 2013, so just in the middle of the second 5-year plan of China, so we'll be continue to solve some system-wide problem, such as now 3 systems from the administrative point of view, they are belong to the 2 ministries. So this is segmentation of the health insurance system is a very big issue. Nowadays, debate lots as a hot topic, how to merge together. And the second is public hospital reform. We just started. And even the provider payment system reform, still maybe the global budget control is the major measurement, and also we need to consider the DRG system step-by-step approach. So finally, I would like to say the 3 major points. I hope you will understand what I mentioned during my presentation. Thank you very much for your attention.